All right. I'm really looking forward to this conversation with you, Dr. Rachel Ollivier. I know that you are a full-time nurse practitioner and also a women's health scientist. You're in Vancouver. You
Yes.
did your PhD in Halifax at Dalhousie, and that your PhD and your research was focused around sexual health after birth. And it's interesting because I thought, like I actually like you reached out to me, which I'm so thankful because um I think that you just nailed this like right before we hit record is that I think a lot of times like I'm starting to hear more and more from people like yourself that are doing the research um because it's hard to get the word out. You do all this research, you find out all this great information that it's applicable to so many people, but it's not that hard to share. And a lot of times I think like the researchers aren't the ones that are naturally putting out the information, and some of us that are putting out the information, we need to like get together a little bit more and just to be able to share it. And I think that's what social media and podcasts and everything are such a blessing for, is sharing some good quality content. So I would love for you to start by telling everybody a little bit about not only like what your role is, like what does your day-to-day work look like right now? And then let's talk a bit about the research that you have done on the topic of sexual health.
So thank you again, Melissa, for having me on. It's a pleasure to be here today. As you said, to speak about these things that we don't know if we get the chance to, and to, hopefully have these conversations be more, relatable and out there, so to speak, in terms of, translating research into practice. So my day to day at BC Women's Hospital here in Vancouver is, one that's very mixed, which I enjoy. So I work full time, 2 days, so 2 days a week. I'm in a women's cardiac health clinic. And the other 2 days a week, I work in complex gynecology in the Access Clinic here at BC Women's, which primarily serves patients who are living with either intellectual or physical disabilities, or otherwise have barriers to accessing gynecological care with their primary care providers. So we offer, a wide range of gynae care in that setting, which I love. And I have 1 day a week protected for research and leadership. So I am currently the nurse practitioner lead for the new Midlife Women's Health Program that will be rolling out here at BC Women's, which is very exciting. Has been in the talks for about a year, and I am privileged to be leading that team and have time for research, as I said. So I collaborate on a number of projects. I'm leading my own work here in BC that will be looking now at sexual health postpartum in the later postpartum period, so 6 to 12 months. The research we'll talk about today was focused kind of on the first 6 months. But yeah, it's really a variety of things that I do. I volunteer in the community. I'm on a few boards. I do policy work with perinatal services of BC. Lots and lots of things. So that's kind of the again the range of my work, which I would not have it any other way.
Seems to be just like an explosion of women's health research lately. And so it's really interesting to be able to share this. And if I could just set the stage a little bit and explain like how this might fit together. So as a pelvic health physio, I would say very rarely do people come in specifically like postpartum women, do they specifically come in to talk about sex? Like usually it's more they won't bring that up necessarily in the intake form. I obviously ask questions about sex, but I wouldn't say that that's their most meaningful thing that they're coming in for, is that they want to ask me about sex. It's usually, I want to see how I'm doing. I want someone to tell me about my pelvic floor. I'm nervous to get back to exercise. I'm leaking when I cough or sneeze and it's not getting better. I'm worried about prolapse. Very rarely will they bring up sex. And I ask all the time, like whether they do bring it up or not, I always say, have you ever had intercourse since you've had your baby? And obviously there's a wide range of answers. Sometimes like, oh my God, no, 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 no. Like and I always say, like, tell me a little bit more about that. Would you say it's because the baby's in your bed? You can't imagine feeling like you want to have intercourse, like there's just no desire? Do you feel like you just feel disgusting, like in your pukey PJs? People often say, like, I don't like my body and I don't like my house. I smell and there's like breast milk all over me. Or are you scared? Or did it hurt last time? And so I think that they feel so much relief to be asked, but I think about so many things around. I'm working with a project in our community right now, led by one of the urologists, and she's put together a bunch of us from different professions, a nurse, a gynecologist, and we're trying to put together a comprehensive resource for people in the area just to start thinking about some of their conditions and help offload some of the wait lists and stuff like that. Anyways, we had to put in a bunch of different conditions and topics, and the issue of sexual health came up. And we were all kind of trying to decide whose department is this, right? And that's the thing, is that who does it fall to? And so I'm looking forward to having this conversation because I think that quite often it's just not addressed by anybody. So
Absolutely.
will you start by sharing a little bit about like what did your research actually look like? And then let's talk about some of the findings. Like where did it come from? Why did you start asking some of these questions and what were your methods? How did you ask people? You said it was women within the first 6 months postpartum, but tell us more.
Yeah, I would love to. The topic came about really with a combination of my interests clinically and with some volunteer work that I'd done during my undergraduate degree with Options for Sexual Health, which I now serve on the board for. And kind of looking at maternal health, I knew I had an interest in that coming to Dalhousie and starting my grad studies there. And slowly it evolved to kind of, help me think about, what are some of the gaps that I can address with this work, and thought of, okay, the combination of maternal health and sexual health, what is that looking like? Okay, so let's look at the literature on postpartum sexual health. And, lo and behold, there are many gaps in that area of research. And so it really kind of seemed like a perfect, marriage of my interests, and of course was contributing something important to what we know about that topic and what we can do in care as well. So looking at designing the study, I interviewed 11 participants who were in Nova Scotia, and our methodology was feminist post-structuralism and discourse analysis, which are terms people have not often heard, which is definitely okay. But essentially what we were looking at was not only to understand how people experience their sexual health after birth, but also how they kind of made meaning of all these different facets of sexual health. So whether that was body image or their identity as, now a mother and also as a sexual being, and navigating that, navigating what society tells us about sexual health or about postpartum bodies or about breasts. We wanted to, yes, understand that individual experience, but also look at how this is kind of related to things that are at influence more broadly. So whether that's in again, as I said, our society, medical institutions, all these different ways and avenues that we talk about sexual health after birth, how is that actually coming into play and influencing how people experience that time and their sexual health during that period in particular. So it was really something that yielded a lot of rich findings, which I'm excited to talk about today.
And it's such a complex topic because it's not just physical, it's not just emotional, it's about
Absolutely.
your relationship. And I think like all of those things are different postpartum, aren't they? Like that's what I think I always try to capture for people like postpartum women, help them see like everything about your life is different. So of course this is going to be different. Like there's your body's different, your time is different, your job is different, your relation, like everything is different. And I think like sex is something like it is not easy to slip into that topic in 2 minutes. Do you know what I mean? Like
Mm-hmm.
it's not, I can see why it's hard to bring up and people just bottle it up inside because how many conversations do you have with people where you start asking about sex in the first 2 minutes of your conversation? Like it's just, it requires a certain amount of rapport or a certain amount of time for people to open up about something like that. And
Mm-hmm.
so I think that's why like barely anyone brings it up. And I think it's so important for us to bring it up as providers. Can we talk? Because I think one of the things that's so important to first talk about it is the importance slash non-importance of the 6 week checkup, because we put so much weight on that time. And I think I hear a lot of people, when I ask them about like, have you tried having intercourse? Some of them have no desire. And so I say, that's fine. Like even if at 6 weeks, you're given the quote unquote all clear, you don't have to have sex at 6 weeks. Like there's no pressure. Other people are waiting for that day on the calendar because they want permission to have intercourse. But can you just talk a little bit about some of your thoughts, some of your findings, some of your thoughts, some of the things that are floating out there are around the pressure or importance of that 6-week checkup.
Definitely. And I think you highlight some of that, very nicely in that, the 6-week check has sort of become a thing. We don't really know how or why that came to be, because actually, funny enough, and I clarify this with a lot of, physicians or other care providers I'm working with, medically, the 6-week check, help it's kind of a time that, allows us to check in on mental health, on physical healing, if the uterus has gone back, down to, um, pre-pregnancy size and things like that. And then sexual health just kind of got added on there, and tagged into that visit, but isn't actually a time that is medically, defined or necessary to be feeling ready for sexual activity. So it's something that, over time, I think has become religious, either, religiously influenced, culturally influenced, socially influenced, definitely, depending on the context. There are a lot of kind of, things out there about the 6-week check. And what I found in my research was that the participants really did have that dual meaning, as you pointed out, where some very much felt like it was, a bit of a milestone and sort of like, okay, we made it to 6 weeks. It had, kind of that positive meaning. And then for others, it felt like a bit of a deadline where it felt too soon, it felt rushed, it felt very arbitrary as well. And it was sort of like, okay, what does this mean? Am I supposed to be feeling ready? Because I'm definitely not. And so then kind of the feelings that came with that. So for some people, again, they had that checkup with their healthcare provider. Not everyone does. But sometimes that'll be, with a physician, midwife, nurse practitioner. And we're kind of feeling, okay, does this mean that I'm supposed to be feeling ready? And then it was kind of brought up those feelings of, okay, navigating that, because even when they did get that all clear from their healthcare provider in terms of physical healing and recovery, there was still that emotional component as well, where it's, they were thinking, okay, so even though technically I'm cleared, I'm definitely not feeling ready emotionally or, relationally with my partner. So how do I navigate that? How do I communicate that, say with my partner, say with my healthcare provider? Um, it was something where people really had to kind of trust their gut, but that can be tough when you have all these external messages, from society or from your healthcare provider. And it's, not necessarily to say that people felt pressured from their partners or healthcare providers. Everyone did, in my study at least, thankfully had positive, experiences that way. But it was still that internal, that internal dialogue a little bit of, okay, what does this mean for me? How do I navigate this? What's normal or not normal? Um, and kind of, again, it was a big time that people talked about, and how it actually came up in my research was from me asking, what was a time postpartum when you thought about your sexual health? So whether that was in the shower, in the grocery store, anytime, it could have been any time. It was an open question. And every single one of the participants said, you know what? The 6-week check. So it really was very authentically a moment for people. And that actually, when people ask me, what surprised you most about your research, that's my answer. Because, it's not that I was surprised that it was a moment. It was just how significant of a moment it was for people, or a time it was for people.
And don't you think too, we're so quick as providers sometimes to think we know what their concerns are? And so what I mean by that is like if I bring that up, because I like to see a lot of my clients before 6 weeks online, because I just don't, from my history in acute care, like we don't wait 6 weeks to see anybody. We see them very soon to give them guidance, to ease their mind about mobility. And so I like to touch base with them, in the first couple of weeks after, to ease their mind and give them some suggestions. I can't say sex comes up in those conversations in the first couple of weeks. Like nobody's thinking about that.
Mm-hmm.
I quite often say, would you like to come in around 6 weeks? Because I know that's a huge milestone for them. And so that's when I always ask about sex. Tell me your thoughts. Like, are you eager? Are you not eager? And I always ask why. And there's like 100 different answers I could list. And for some of them, it's, I actually don't want to. I don't feel like it at all. And my husband understands, or my partner understands, or my wife understands, whoever it is. And so I say, okay, well then let's talk about that later. I'm not gonna, like, that's not where you are right now. So let's shelf that for now. Other people will say like, I am terrified. Like, how does my pelvic floor relate to sex? Like, is it gonna hurt, or is it gonna feel loose? And so I always spend time. Okay, so that's meaningful to them. So then when I do my assessment or whatever they want me to do, I'm gonna make sure that I talk about how intercourse would be influenced by their symptoms. I can explain that when a finger or a penis or whatever goes into this entry, this is what the muscles look like. This is how they behave. This is how you have control so that I can make it meaningful. Maybe they've been told they have some prolapse or something like that, and they can imagine that their partner is going to be bothered by that, or that they're going to be, it's going to hurt. I'll explain to them how that tissue, the vaginal tissue, moves out of the way when something goes in, and prolapse by itself shouldn't hurt. Um, is it that is it just, a fear of yours, or you're worried it's going to be dry or something like that? Let me show you some good lubricants. It's just so different. And I think that we're quick to just um, kind of assume that everybody's the same without asking, like, what are your concerns? Don't you think?
Definitely. And I think it's also kind of oftentimes I think when we talk about sexual health, or even when I talk about my work, there's this assumption of, oh, okay, you say sexual health, do you mean sex? I said it could include sex, but include a lot of things as well, other things as well. And so I think whenever I approach it with patients, and I love how you describe your, discussions with patients. I think that's so great. I leave it very open. So I say, things like how, what are your thoughts around on your sexual health at this moment? Or how would you describe your sexuality, your sexual orientation, things like that, where they can really bring forward and define that for themselves. So whether that's, the emotional components, the relational components, or the physical components, it allows them to make that choice for themselves and define it for themselves in relation to their concerns or what they want to talk about me with in the appointment. And it also sends the message to patients that this is an important part of your health. This is a normal conversation to be having. We don't have them enough, but it normalizes and invites that a little bit, which I think can be really powerful.
Absolutely. And as soon as you said that, I was like, yeah, interesting that I think I'm as a physical therapist. That's what people would think about me first. Like, think about, like, I would be addressing the physical things first, but sometimes it's not that they bring up at all. And
Mm,
so that I think, again, another benefit to learning more about what other people do is I might think about other practitioners, right? And like, oh, this is your big issue. Let me put you in touch with somebody, right? Because absolutely the physical component is important, but maybe the physical is secondary to something else or what have you. Yeah, I think that's
definitely.
important. Another thing that comes up a lot of times, so that, we've mentioned the 6-week checkup and how much importance that holds for a lot of people. I would say another thing that comes up quite often is just like, um, I don't even feel like I want, like, I'm getting mixed up whether, like, because my body parts, the same like sexual parts I had before for pleasure, are now for like milk making. And like my baby came out of that area, so I can't link pleasure to that right now. Can you talk a little bit about how that came up in your research? Because that is a really hard thing for people to wrap their head around, too.
Definitely. And it did come up in my research, again, in terms of sort of that, those multiple meanings or dual meaning of certain body parts, specifically the vulva, the vagina, the breasts. And it's, again, bringing in that kind of societal piece as well. I think oftentimes the breasts are viewed as either being in a sexual context, or as a sexual part of the body, or for nurturing, for, nursing, for breastfeeding. And there's kind of that, again, duality that positions that as being okay. It's either for one or the other, but can't be both. And I think that's what people are often navigating during that time, because it's a new function that your body has, if you are nursing or breastfeeding. So it, changes not only how you view your body, but also how your body is working and, how you're relating to your baby, how, all those kind of things are coming up in terms of being a new parent. So it is. I think when people spoke about that in my research, it really was a bit of a journey, for lack of better words. It was something that did fluctuate and did take time to kind of see things in that way again. I remember one participant talking specifically about her vulva and saying, exactly what you said, saying, this is what delivered the baby. It took a while for me to see it as something that I could derive pleasure from again, given, of course, everything that goes into childbirth, not only the physical trauma associated with that, but any injuries people might have, of course, the pain associated with that. So it was also, again, this duality of pleasure and pain, in terms of that body part in particular. So it's definitely something I think people are navigating. Their body is often, I think, for people who were describing that in my research, we're talking about how their bodies felt very new, or like they didn't recognize their bodies. So it was sort of, again, this whole journey of kind of getting to know, okay, this is what I look like now, how do I look, how do I feel about that? And then also, what are my sensations? So of course, being a pelvic floor physiotherapist, you would see this a ton in terms of altered sensations as well, especially kind of in that genital area, depending on people's, their birthing experience, their level of physical injury that was a result of that. It's all these kind of, things going on for sure. So it's a very packed time in that sense. And I think it does take time, no matter what people's experience or perspective is. It takes time, I think, to kind of find that connection with yourself again, and see that not only physically, but, emotionally, in terms of your identity as well.
And I would say, like, I mean, I've been practicing in this area for about 10 years, so I don't really have experience in this area before then. But I feel like there's so much messaging now around like, I'm damaged. I need to get back. Things aren't the same. And when people say that, I'm like, oh, that is too bad. That's what you've taken out of this whole experience, is that you're damaged. And that's what a lot of people's most meaningful thing is, like, because well, that's what I always ask when people come in, like, tell me why you made this appointment, because that invites them to describe it however they want, and like, what would you like to get out of this, what out of our time together? And it's a lot of times like, I want you to see how bad I am, or I want to know where I'm at. Right. So they're looking for someone else to tell them. And I always, like, I quite often find myself saying, like, just so you know, like, before I even look at anything or lay my hands on anything, like, you're okay. And I'm going to be sending you home with lots of messaging around, you're doing great because you came in here, you walked in here, you are managing a baby. And before I even lay my hands on you, I'm going to find some changes. But do those changes actually mean damage? You know? So it's really interesting. I find, like, do you think that that's always been the case? Or is that new? Like, as we have more and more information and we're sharing more, has the language changed around that we're damaged after?
I think you see it quite a bit, and I'm glad you bring it up because it's a lot of now, I think, with media and that society's messaging around that, of exactly like you said, that need to bounce back and return to, pre-pregnancy, fitness level, size, weight, abdominal circumference, all these things, um, as sort of being this goal or this thing that, postpartum women should be trying to do. And I think it really is not helpful, I think, to many, many people, because it, not only creates that pressure, but also creates unrealistic expectations, I think, at times, and just, reflects it in a light that I think is not necessarily, lending credit and lending positivity to, what their experience was in carrying a pregnancy and giving birth. When I talk about this aspect in particular, I often kind of relate it to something like perhaps a surgical scar, or a scar from an injury or something. To me personally, and I know sometimes it can be easier said than done, that part of damage is something that, is there because of what your body accomplished in doing this amazing thing in carrying a pregnancy, giving birth. It's something that tells your story. Your body tells your story. And so, reframing it as something that again can be, more on that positive aspect, I think is, how we can counter it a little bit. But absolutely, I think we're seeing so many images in media and Instagram posts about, new moms and all these things that are idealizing in this period, which can be very difficult, for people. And so having those realistic experiences be shared helps us also understand that there are multiple ways of seeing this and multiple realities within, anyone's experience postpartum. But no, absolutely, there's a social discourse that is exactly that bounce back culture, when, I think a lot of times that isn't necessarily a reality and isn't necessarily a goal I think that people should have. It's, to me, an evolution of your body, of, your personality, your experiences, that are all lending into, you now being a parent, which I think is so great. So again, I know it's easier said than done, and those messages are powerful, so it can be hard to ignore. Um, but no, I think you bring up a great point in that a lot of our conversations around this are shaped by those, those messages we get from the media. And on the other hand, talking a bit more about pelvic floor and even understanding what that means, that word, when my mom gave birth and my grandma gave birth, that was definitely not a thing. And so now, we're also seeing the other side of the coin where we're having those conversations about pelvic floor health, which I think is so great. And having that be, again, part of postpartum discussions of recovery, of care. So yeah, there's always, again, those other aspects that I think have changed in a positive way. So
Absolutely. And I think that kind of leads nicely to, I know something else that you've talked about before is kind of navigating a new identity. Because I think, like you mentioned, like different seasons, I think you said sometimes I describe it as chapters. And I think we all sometimes we think everything has to be in every chapter, if that makes sense. Like I have to be like really sexual at the same time that I'm a mom or like a new mom. And so I think sometimes remembering that like every chapter's filled with different things and a different mix of things. And so yeah, postpartum, you're going to feel like your sexual identity or maybe your desire, it might feel a lot lower and it might be a very different relationship with your partner. But maybe there's other really good things about that time. And I think that again, one of the benefits to my job is I get to see all sorts of different people in their chapters. So maybe I have a bit more perspective, right? Than the one person coming in is just in their chapter. But I can see that people go through different stages and there's times where they're like, "Oh my gosh, are you serious? You think I'm having sex or you think I want to?" But then all of a sudden they might come out of that chapter and all of a sudden they're like, "Do you know what? This almost feels embarrassing to say, but I want to have sex again." Is that weird? And so can you talk a little bit about that? Because I know that that's something that you've maybe got out of your research too, is people's identity and they're getting confused a little bit about who am I supposed to be?
absolutely. And it did come up in my research, for sure, in terms of, yeah, just that identity piece. So identity, as a mother and also as a sexual being, I think in society, those are often positioned as being in opposition to one another, where motherhood is very much positioned as this sort of all-giving, nurturing, selfless role, that, in essence is one of purity, which does not involve, a sexual identity or a sexual, anything really. So there is certainly, that kind of that historical positioning of motherhood that I think has been in existence for quite some time. So, again, repositioning that for a lot of people in my research, it sort of said, okay, I know that I can be both, and that's okay with me, but it's just navigating, okay, how do I see myself now? And what comes first sometimes? It's often, the role as a parent, especially when you're a new parent and learning a lot of, what comes with that. So, identity, yes, I think we have the message that it can be both. But for some people, again, I love the analogy you use in terms of, the chapter having, always a mix. We don't have to be everything all at once. I think especially as women, we are often given that messaging from society that you have to be, this giver, but also the fighter. And anyway, that's a whole nother topic. But it's yeah, definitely something that people are thinking about postpartum and trying to kind of redefine from that, redefine how they share intimacy in that postpartum period. I think a lot of it comes from first not only thinking about themselves as a sexual being and okay, how do I relate to myself or others sexually, but also what does that look like for us? So for people who are in relationships, which in my research, all of the participants were, discussing, okay, so intimacy, for them it was still important. They still very much valued that emotional connection with their partner, but intimacy didn't necessarily need to include sexual activity or sexual intercourse. And so that was one way that the participants in my research in particular navigated that period in terms of, okay, what does, our sex life, for lack of better words, look like now? How do we still maintain that emotional connection and that sense of closeness and support of one another, that teamwork? When, yes, we're navigating new roles as parents, we're, finding out who does what and who does these chores and the, all these things of, okay, what does parenthood look like for us as well? But yeah, a lot of that kind of meant still making time for each other, cooking together in the kitchen, still flirting, making jokes. I think making light of a lot of the challenges of parenthood was something that people talked about. So whether that was kind of, trying out, sexual activity for the first time and someone's breasts, were leaking or something like that. And, just kind of learning to laugh at things, I think a little bit too, it helped develop that sense of partnership and openness with each other. So that was kind of, I think, also a great example in terms of how people are kind of, redefining that for themselves, not only in terms of their identity, but also, okay, what does the reality look like for us now?
Feel like social media kind of affects that a bit too, because I think this is my take on a lot of it is sometimes people like they'll share with me maybe what they want or, as a couple, maybe what their hopes are, but they're sometimes caught up in what they think they should do because that's what social media is all about, like someone
Mm-hmm.
else sharing their opinions. And I find that like sometimes people um their common sense maybe goes out the window sometimes because they're so inundated by what other people are doing that sometimes bringing them back to like you can make this look how you want to. And like I've had some people, I think it's more often than not that new moms come in the postpartum period and say like I don't really want to, and they sometimes just need to be told and that's okay, whereas the odd person will come in and say like I'd like to have intercourse every day, and I find myself wanting to be like what, because it's just not what I hear all the time. But of course I say like that's great, that's what you want to do, and no two people are the same. And I think it's important to have, to be confident with your wishes, but then also be willing to talk about it with your partner because you don't have to do what everybody else is doing, right?
Definitely, definitely.
Yes, it's hard for people.
Yeah,
I'm finding for practicality purposes, let's picture that first, there's someone in the postpartum period that's listening to this. What are some suggestions you have for them? So um given that we know that there's very little time in appointments and especially after that 6 week appointment to talk about this, what are some things that, because we should be advocating for ourselves too, right, as new moms, what are some things you want people or listeners to almost take out of this, to be, let's say, asking or advocating for or talking at home, like just some take home messages for listeners that would be part of this population?
definitely. And it is. It's something I wish, we had more time to talk about, but the reality of those appointments is that we're often very rushed and packing a lot in. But I think for a lot of people, and going off of my research as well, it's just kind of sometimes lack of information about, for many, it was sort of like, I didn't know that these resources even existed. And then finding them and found that they were so positive. So pelvic floor was one of them that, for the people who accessed it, found it was so positive for them. But even kind of down to, again, the practical components, talking about, perhaps perineal massage, if people are having kind of tension or pain in terms of their pelvic floor. Again, you you can speak to this better than me, but those are some things I suggest is, perineal massage prior to any sexual intercourse, lubricant, so water-based or silicone lubricants are safe to use with an external condom, otherwise known as a male condom. Silicone, I find, tends to be a bit better just because water-based lubricants, sometimes I think people feel that they have to use quite a bit because the body absorbs it a bit quicker. So silicone-based lubricants can help make things more comfortable. Again, making time for foreplay and relaxation and all those things that we always hear. But I think also one thing that really gets overlooked, but some people in my research talked about, is self-touch and masturbation as a way to get to know their bodies and kind of help eliminate that fear of pain that I think people are often having when they're thinking about returning to sexual activities after birth. It's one way that for the participants who talked about it was a way that they could get to know their bodies, know how things felt without kind of needing to externally communicate with a partner. It was something that, of course, they could do on their own and have kind of a safe space for exploring, okay, what are things going to feel like? So that's something I really encourage, whether or not people engaged in masturbation or self-touch prior to pregnancy. I think that really is a tool that is also great in terms of, approaching the physical components of sexual activity. And yeah, again, we have a lot of research online, which can be very overwhelming. But for folks in BC, Perinatal Services in BC will be developing some content on sexual health after birth, which I think is awesome that we're, having this be more accessible. But those are kind of some of the things, and bringing up with your healthcare provider. For example, I remember talking to a mom who was a second-time mom and said, I didn't know that I could ask for an estrogen cream to help because I was having, dryness, vaginal dryness, which is a very common experience for people who are, nursing or producing milk as a result of the hormones that are involved with that. So even just again, awareness that there are tools to help with some of these things. And it's also about having that safe space. I've heard on the other side of the coin, I had one mom in my research discuss how she did bring things up with her family physician at about the 6 month mark, was still having quite a bit of pain with intercourse, and so brought it up, and was told to use Crisco and return in 6 months if it was still a problem. So, hearing experiences like that for me is very disheartening that, in today's day and age, those concerns, if and when they do come up, are being brushed off. So, for patients who are listening in, I also acknowledge the reality that, every healthcare provider is not always supportive or knowledgeable about these things. But I think hopefully we are getting a lot better, as you discussed as well with your practice. So yeah, for those listening in and those who might not have that resource and having a primary care provider, those are some of the things that I suggest in terms of kind of easing the transition to returning to sexual activity.
Wonder, so yeah, because I think I like as you bring that up, I think a lot of people don't understand what we do have to offer as physios. I think we are associated often with incontinence and prolapse, but not always like intercourse or sexual activity. And so I think at the end of the day, how I would describe for people listening is that the pelvic floor is a group of muscles you're not used to thinking about. They're so automatic and so reflexive. And so it'd be very normal that you don't realize how you can use them to your advantage or how much control you have. And I think a lot of times that's what it comes down to is people are nervous because they don't feel control of something. And
Mm,
so that's what I would always start with is just some education to show you what the muscles look like, show how things like stress and nervousness would increase tension and maybe make it harder to penetrate or harder to feel pleasure. Um, Always give people a sense of control if they don't feel like they have it. So, how to feel like you can relax those muscles, how to feel like you can tense those muscles. And I think a common theme as I'm talking about this is most postpartum women assume they're, I'm using air quotes here, loose. They think
mm,
that their everything is gonna, like their pelvic floor is gonna fall off the hinges and they're not gonna have any tension. But the nervous system is too smart for that. And quite often you find that postpartum women are holding a lot of tension, be
mm,
understandably, because oh my gosh, I had this vaginal birth, or maybe I had a lot of bleeding after, or I had stitches. And so there's an automatic holding. And if anything, that holding, is this causing more of the symptoms or causing more of the pain, if you will. And so helping them establish that sense of awareness of what it feels like to feel the control. And then, like you mentioned, there's so many different ways to progress that, whether I suggest they put their own finger in there to feel, or look with a mirror, or if they have a toy or something like that they feel like inserting to practice on their own first. How could you use your partner's finger before anything else? How to know when maybe to stop if you feel like you can't alleviate the discomfort. Positions where you feel control to start with, because often I say like your partner might feel excited and not be taking their time, whereas if you're in a position of control initially, you can kind of determine the speed of the penetration and you have that control. So again, no two people the same. And I think we're in this time where we're trying to get everything from social media and you can't take everybody's opinion as what you need. And so yeah, I listen to you and I think about that. But I also think like like that would be a physical kind of addressing it from a physical point of view. But what about all those people that have maybe had a lot of birth trauma, and maybe that birth trauma is on top of a previous sexual trauma or something like that? And I'll be honest with you, sometimes the physical is just not enough. And so that's why I think it's so helpful for us to have in our back pocket a list of different sexual health or mental health providers, because sometimes people need to talk to someone about all of this, right? And I'm sure that that's something in your practice too. You start to recognize like there's certain people that maybe are very tearful through the whole session, or will just bring up like, that it's a very big thing for them. And for those people, like the mental health consideration is huge. Yeah.
absolutely. I think it can be, a huge mental and emotional toll in terms of how people are navigating this anytime, whether that's postpartum or not. I've been fortunate to shadow a little bit in the chronic pelvic pain and endometriosis clinic here at BC Women's with some of the gynecologists there. And it really is, not uncommon for people to become tearful in our appointments because they've been dealing with this for so long. They haven't been believed and they haven't been provided the care resources that they need. So finally having someone who's there to listen, who believes them and their pain and, validates their pain as being true. Even that is huge for people. So with this, some of my other messaging around this is that I never want anyone postpartum to feel like they have to deal with it, that they
Mm-hmm.
have to put up with pain, that it's just
Mm-hmm.
part of it. It's not true. And so, whether that's the physical component like you touched on or the mental and emotional pieces, again, we're starting to understand how important all of those components are and how interrelated all of those components are. So in terms of, women's sexual health, we have leaders across the country. Dr. Lori Brotto is one of them who's here in Vancouver. Who does do some private practice as well in terms of sexual health counseling. So for some people in more rural areas, a sexual health specialized counselor may not necessarily be accessible to them, but with telehealth and things like that, we're hopefully opening up those doors for people no matter their location. But no, absolutely, I think that those experiences of previous trauma for folks who are survivors of sexual assault, for people who had, as you said, traumatic birth experiences, it all relates to it. But I think, again, we're starting to realize the importance of having those multi-source and interdisciplinary supports, depending on what people's needs are, because they fluctuate as well. There's never kind of this, okay, I've crossed the finish line, I'm feeling good. There will always be ebbs and flows, whether that's in that immediate postpartum or, years later too. So, it's always an ongoing negotiation, ongoing conversation, and ongoing experience.
And don't you think too, we're moving into this phase where, like, I think as we want to empower patients more, and I think it's up to the person listening, the new mom or the postpartum person to really reflect on like what's my issue is kind of sounds like a negative term, but like what's at the heart of my problem? Like, do I feel like it's a physical thing? Do I feel like it's a relationship thing? Like, I think that we as patients too have to take some of that onus on to do some self-reflection because in a short appointment, like there's no provider that will know you as well as you. And so I think like I think like that would be another message is like really reflect a bit on what's my hang up because it'll take me longer to figure out what your hang up is, I think, than you will yourself, right? And I think like so that transitions a bit to like providers listening. What can providers do? Because I just as uncomfortable as it is for a patient to bring it up for their provider, I think providers feel uncomfortable sometimes, right? If you don't make yourself ask your patients about, like I've talked to other people on this podcast before, there's one kind of coming to mind like a urogynecologist that I talked to, and she said, I just ask everybody. Like it's just a rule. I just ask everybody. And then it's not awkward for me or it's not awkward for them. And I let them know that I ask everybody. I don't think all providers do, but I think, would you say that that's a take home message for providers? Just ask, open the conversation, and just make it a rule that you ask everybody.
Definitely. And I think it's something that, when I present to healthcare providers, it's, something I often bring up in terms of practical ways to bring it up because I understand, of course, the constraints of our appointments, the reality of practice. I'm also not blind to that. And that, again, as I said previously, we have so much to often fit in. But asking something like, yes, what are your thoughts on your sexual health right now? Lets the patient be the one to bring forward what they think is most important rather than having us be the ones to decide that. And also just having tools. So one way that I, have kind of built on this through my research is by creating, a simple one-page patient educational tool on sexual health after birth. And we give it, it's been rolled out on dozens of postpartum units across Canada, public health centers, and even if that in that immediate postpartum period, they have a lot more on their mind and usually sexual health is on the back burner in that, that immediate postpartum period. But it's kind of something that invites the conversation and is also providing a reliable source of information that, as I said, is not the Google rabbit hole. So that's also something I think that can be really useful for providers because it's something they can give. It doesn't take too much time, but gives the patient also some time to take it home, reflect a little bit, think about how they're feeling, their questions, and then bring it forward back and say, hey, I read that pamphlet you gave me at the other appointment and actually had a few questions I wanted to ask you. There we go.
Mm-hmm.
So again, it's easier said than done sometimes for providers, just because again, we're often trying to fit so much in. But yes, I think it's important to ask the question to invite the conversation, whether or not that's verbally during the appointment or through things like giving a simple pamphlet. But it's something that we often overlook and don't necessarily acknowledge. And then it can make it difficult for the patient to bring it up. And when we look at the research on that, we do know that often patients do expect healthcare providers to be the ones to bring
Mm-hmm.
it up in terms of that topic in particular. So yes, we have a position there where we can again reframe what happens in the appointment and use that hopefully to the patient's benefit and to our relationship with them.
Absolutely. Is there anything you feel like is worth noting that I haven't asked you about?
Oh, that's a good question. I think, we really talked about a lot of the research themes that are quite common, which is great. Again, practical tips. When I lecture to a nurse practitioner or medical students, I go over those practical tips that we talked about because, again, people don't necessarily know, if a patient were to ask, okay, so how can I make sex more comfortable during this postpartum time? A lot of healthcare providers would probably give you a blank stare. So I'm trying to help on the teaching part in terms of how care providers are educated as well. But no, I think really, it's a nice blend of kind of the clinical piece and the research piece. So nothing I can think of.
I would absolutely love to link anything, any resources that you think that we've talked about or maybe that we haven't that you think would be helpful for listeners. You and I can connect after this and I'll make sure I get some of those from you to link them in the show notes.
Sounds
Um,
great.
any other, so it sounds like maybe like some of your future research will be focused on that period after 6 months. Is that right?
Yes, yeah. So we've applied for some funding. Fingers crossed, I get some to yes do some research here in BC, looking at later postpartum. So it would be a similar design in terms of the research. I'd be looking to interview around 10 participants, just because the interviews are often so in depth. And yeah, have them be in that later postpartum, so 6 to 12 months. We know in the literature, sexual health issues in particular can persist kind of 18 to 24 months after birth. And so with that, hopefully getting kind of more of a snapshot of what that later postpartum looks like. A lot of the research that's been done in this area often either focuses on couples, which I think is important. I think partners are, of course, so important to include in this work. But I think also sometimes with that, the conversations in those interviews often kind of automatically get shifted to talking about sexual activity because
Mm.
it involves both partners. And so that's sort of where the relation is. And also, I think sometimes it can be difficult to be truly open and honest sometimes when you're being interviewed and your partner's right there. Again, not to say that research isn't hugely
Mm-hmm.
valuable, but I think where I come in is really zeroing in on the postpartum woman or postpartum person's experience. And hopefully, yeah, being able to really delve into that more deeply. So, yeah, I'm excited for the work we have ahead, and we'll be able to, yeah, hopefully understand more of what's going on in later postpartum once the dust has kind of settled. I think, I have a friend who's about 8.5 months postpartum right now, and we were chatting, and I think there's also kind of some issues that can come up once the dust has settled, and those first 6 months can just feel like
Mm-hmm.
baptism by fire a little bit, and you're just trying to figure everything out. It's a really intense time. So no, it'll be interesting to see what our findings are from that.
Well, listen, I appreciate your time today, but also just like your time to like research involves a lot. And and it helps so many people and it really does guide our practice in so many ways. So I appreciate you on so many different levels. And if I can ever be of any help, then you know where to find me. So thank you so much.
Thank you so much for having me on, Melissa. It was a pleasure.